Hello, you're welcome to the teacher channel and welcome to this presentation, which will be practice questions part 1, and it is going to be on BLS, basic life support. So practice questions part 1. So the objectives, you can use what will be presented to assess your knowledge of the basic life support. You can also use it to prepare yourself, okay, for a basic life support training, to prepare you for a basic life support training. So if you are planning to attend a basic life support training in future, either close or far from now, you can use this to prepare yourself. Number 3 objective is to determine how much you know or how much you need to know in basic life support. So you can use the questions and then the answers you are going to return to those questions. Use them to measure how much you know or how much you need to know in basic life support. Please attempt all the questions. So there will be 20 questions in all. They are all multiple choice questions. So take a piece of paper and pen. Then for each question, indicate your answer. So at the end of the presentation, when we present our answer keys, you should be able to match what you have on the sheet of paper with what we're going to provide. Okay? So please make sure you attempt all the questions. And before we start the questions, please, I'm going to ask you to subscribe to the channel. You can also turn on your notification bell. Question number 1. Cardiac arrest is not different from heart attack. Cardiac arrest is not different from heart attack. A, true. B, false. C, both A and B are correct. So indicate the letter that matches your choice to this question. So we'll be going to question number 2. What does CPR stand for? What does CPR stand for? A, cardiac pulmonary resuscitation. B, compression push revival. C, controlled pulmonary resuscitation. D, cardiopulmonary resuscitation. What does CPR stand for? So please indicate your answer and let us go to question number 3. Question number 3. Mr. H just experienced cardiac arrest. What signs and symptoms are likely present? So Mr. H is a victim, is a patient, just experienced cardiac arrest. What signs and symptoms are likely present? A, agonal gasps. B, shortness of breath. C, unconsciousness. D, both A and C are correct. E, only C is correct. So please make your choice and we go to question number 4. You are expected to check the pulse prior to starting CPR. What is the normal pulse range in 25-year-old victim? A, between 30 and 75 beats per minute. B, between 90 and 125 beats per minute. C, between 60 and 100 beats per minute. D, between 100 and 150 beats per minute. So make your choice, and then we go to question 5. CPR is a life-saving skill which is comprised of. CPR is a life-saving skill which is comprised of A. Chest compressions, B. Breath, C. Abdominal thrusts, D. A and B are correct. Question 6 is underway. Question 6. How do you define a CPR cycle in an infant victim? How do you define a CPR cycle in an infant victim? A. 15 chest compressions and 2 breaths. B. 100 chest compressions per minute. C. 30 chest compressions and 2 breaths. D. All the above. E. A and C are correct. Question 7 is coming. Question 7. Once you start CPR, you should continue until. Once you start CPR, you should continue until A. You nearly pass out, B. You become exhausted, C. Someone calls EMS, D. All the above. Question 8. A high-quality CPR is recognized by the following attributes. A high-quality CPR is recognized by the following attributes. A. Compressions are hard and fast. B. Rate of compressions is 100 to 120 per minute. C. Chest recoils fully between compressions. D. All the above. A high-quality CPR is recognized by the following attributes. So make your choice. Write it down as we go to question 9. How do you know that the breath given during CPR are effective? How do you know that the breath given during CPR are effective? A. You feel the breath on the victim's cheeks. B. The victim's chest rises visibly. C. The breaths are very forcefully delivered. D. None of the above. Question 10 is underway. Question 10. You were performing CPR on a 2-year-old victim. A bystander joins you 3 minutes after to make it a 2-rescuer scenario. What main change should be made? You were performing CPR on a 2-year-old victim. A bystander joins you 3 minutes after to make it a 2-rescue scenario. What main change should you make? What main change should we incorporate? A. Switch from 15:2 to 32 compression to ventilation ratio. B. Use 2 thumbs instead of 2 fingers. C. Switch from 32 to 15:2 compression to ventilation ratio. D. No change is expected. Question 11 is coming. Which of these statements are correct about CPR? Which of these statements are correct about CPR? A. The rate of compressions is the same for infant, child, and adult victim. B. The depth of compression is at least 4 centimeters or about 1.5 inches in an infant victim. C. The depth of compression is at least 7 centimeters or 2.5 inches in a child victim. D, A, and B are correct. Question 12 is coming. Question 12. Tim and Julie are performing CPR on an adult victim. When do you expect them to switch the compressor role? Tim and Julie are performing CPR on an adult victim. When do you expect them to switch the compressor role? A. Every 3 minutes. B. Every 2 minutes. C. If the rate of compressions decreases. D. A and C are correct. E, B, and C are correct. Right, so question 13 is coming, and here it is. What does AED stand for? What does AED stand for? A. Automated external defibrillator. B. Authorized electrical device. C. Automated electrical defibrillator. And D. Artificial external defibrillator. So what does AED stand for? A. Automated external defibrillator. B. Authorized electrical device. C. Automated electrical defibrillator. And D. Artificial external defibrillator. Question 14 is coming. Question 14. An AED is simple to operate. What is the first thing to do when it arrives? An AED is simple to operate. What is the first action, first thing you do when AED arrives? Let's see the options. A. Clear the victim to not shock someone else. B. Wipe the victim's chest. C. Inspect the victim's chest for pacemaker. D. Turn it on and listen to the voice prompts. What is the first action when AED comes? What is the first thing to do? So indicate your choice and then get ready for question 15. What is the primary purpose of an AED? What is the primary purpose of an AED? A. It has the same purpose as CPR. B. It prevents cardiac arrest. C. It eliminates abnormal heart rhythms. D. A and B are correct. Question 16 coming. Question 16. What is the right thing to do when a 3-year-old boy starts choking with no sound but still standing? So a 3-year-old boy starts choking and there is no sound coming from the boy, but the boy is still standing. So let's see the options. Option A, encourage him to cough deeply. B, give him water to drink. C, perform abdominal thrusts until the object is expelled. or he becomes unconscious. D. Perform series of 5 back blows followed by 5 chest thrusts until he becomes conscious again. So make your choice, make your selection as we go to question 17. 2 minutes after trying to relieve a severely but conscious choking victim, she became unconscious. What should be done next? 2 minutes after trying to relieve a severely but conscious choking victim, she became unconscious. What should be done next? A. Perform a few more abdominal thrusts until the object is expelled. B. Perform series of 5 back blows followed by 5 chest thrusts until the object is expelled. C. Call 911 and start a high quality CPR. D. Intensify the abdominal thrusts. Question 18 is underway. You are involved in a team effort to resuscitate a victim. Which of the following are part of the team dynamics? A. The team must ensure clear roles and responsibilities are established. Knowing team members' limitations or boundaries are expected. Positive or constructive feedback is good for the team. D. All the above. Question 19 is underway. Question 19. A 2-person team is performing CPR with AED. Which of these statements are correct? A 2-person team is performing CPR with AED. Which of these statements are correct? The compressor roll should be alternated when AED analyzes the patient or the victim. So the compressor roll should be alternated when AED analyzes the victim. The compressor roll should be alternated every 10 CPR cycles. C. CPR should be resumed immediately after delivery a shock based on the AED recommendation. And D. A and C are correct. Again, make your selection as we go to the last question. The last question is coming. And here is the last question, question 20. As of 2022, how long is a BLS certificate valid for? As of 2022, how long is a BLS certificate valid for? 3 years? 1 year? It depends on my employer. B and C are correct. 3 years? 1 year? It depends on my employer. B and C are correct. So these are the answer keys. Okay, so match your own answers with this. And then you can always go back and see the correction if you got any of them wrong. All right. So thank you so much for watching. Please like the video, put your comment, share, and again, if you have not subscribed, I would really appreciate if you can do that. And remember to turn on your notification bell. To contact us, please send email to us at theteacherchannel@gmail.com. theteacherchannel@gmail.com. If you have any suggestion, any opinion, or if you want us to train your staff, send us a request. So thank you again, and I will see you shortly, and enjoy the rest of your day. Bye.